I'm sure many of us have gone for physiotherapy treatment, है ना? कभी मेरा तो 2018 में I had a severe fall and then I understood the impact of physiotherapy. उसके पहले कभी समझ में नहीं आता था. I used to think, what is physiotherapy? Only after that I realized how important physiotherapy is for us. So today we are privileged to meet Dr. Laxmikanth Sabgani. Laxmikanth ji, namaste. How are you?
Yeah, I'm fine. I'm doing good. What about you?
Good, very nice. So let me introduce or let you let the viewers hear from you about yourself.
More than 20 to 23 years of experience in the field of physiotherapy. I have done my masters in neuro, adult neuro, and super specialization in pediatric neuro.
So do you have a clinic in Hyderabad?
Yeah, I have two clinics. One at Attapur, one at Himayat.
So could you share your number or address with the viewers?
Yeah, my number is 9966 404 116. For any queries or anything, you can always contact me. I'm always on WhatsApp also. Any doubts, you can always contact me.
So, sir, you love your work. I can see it from your eyes that you just love your work. What made you become a physiotherapist?
Oh, actually, I have not chosen it. I think the field has chosen it. I really think so. Because I believe in destiny. The destiny plays a vital role in everything. So once I got to know about it, my mother told me it's a very good thing, upcoming field. You know, in 90s, there was no much physio colleges and all. So we had to go to Bangalore, Hyderabad. तो वहाँ पे देखे तो बहुत अच्छा था. And I didn't know that it's so vast, it's so in-depth, you know. So once I entered into it, it's very tough. If you study well, then only you get and acquiring knowledge, acquiring skills. See, physiotherapy is a skill-based thing. So once your skills are updated and correct, then only you'll be able to survive, or you can be able to do justice to the patients. And in that way, we can do very well.
So do we have to prepare ourselves from the school level? Do we have to take some subjects?
After intermediate, it should be 5 pieces. Okay. Then afterwards, you can go for a 4.5 year course. Okay. That's basic bachelor's. Then afterwards, you can have 2 years master course. You can choose your field in masters. Like example, neuro, ortho, then CT, cardiothoracic, gynec, hand rehabilitation, geriatric rehabilitation, pediatric rehabilitation. There are so many, different streams we can choose. And afterwards, if you want to do specialization, super specialization, you can do PhDs also. You can work as a research work. I also have done research in National Institute for the Mentally Handicapped. I worked in NIMH. I've done my PG diploma in early intervention, 0 to 3 years children. There, what I did is, I have been observed there. So 3 years I worked there as a research officer, and I've written 3 books on it. Yeah.
3 books on neuro or?
Yeah, pediatric neuro. Home program for the disabled. So that's a mentally retarded children. For mentally retarded children, how to, in the home, how to deal with the child and how to, do exercise protocol and everything. One book. One other book which has been there for drooling. Drooling बोले तो जो से लार निकलता है, लार टपकते रहता है. तो उसको वो ऐसे children बहुत ही difficult रहता है because they cannot control their mouth, they cannot close their mouth.
But why does this happen?
Because of neurological damage. It's all neurological damage. बचपन में पैदा होते समय during the childbirth, before, during the childbirth or afterwards. ये 3 चीज रहते हैं. So before, if mother has any infections or any trauma, any psychological or any other things, then the child will also get affected. Then the secondary is during the childbirth, if the child doesn't cry, and if there is any trauma of while coming out, or any other things, if needless is not maintained, any infections, then also it can cause some of the other damages. Then if the child is not crying, or it's called failure to thrive, और उसमें भी you will get some of the other problems. So उस वजह से brain में damage होने के chances बहुत ज़्यादा रहते हैं. तो एक बार brain damage हुआ, then intellectual disability, okay, then physical disabilities. So like that, so many others are there. Then there are also, what should I say, all genetic problems also there in children. वो genes में भी problem होने की वजह से so many other things.
So how does physiotherapy help in these problems?
Yes. See, normally we say rehabilitation. Re बोले तो again. Habilitation बोले तो पहले जैसे थे वैसा उनको वैसा बनाना. But in children it is habilitation. Habilitation means first time उन्हें चलने की कोशिश कर रहे हैं. First time रहने की कोशिश कर रहे हैं. First time खड़े रहने की कोशिश कर रहे हैं. So if somebody correctly, for example, if I want to lift this, this thing, so I'm holding it like this and taking it. For a disabled child, it will be very difficult. They might come like this and do it. It's not an efficient way of doing it. So what we do is the best and efficient way. We try to make them do all the activities. So that is physical therapy.
And do you have instruments for that, or just physical?
Hands-on techniques are wonderful things. Instruments will be there, but our field is a skill-based, hands-on techniques, and I am specialized in hands-on techniques. So, उसमें हाथों से जितना भी हो, we try to do all the activity-based and everything. उनका disability के ऊपर we try to do it. And in my clinic, I treat adult patients. Any pains, any neurological adult patients, सब लोगों को हम देखते हैं. We give best of the best treatments for it.
And how do yoga or the gym, all these, do they help in physical therapy or?
See, yoga is a science altogether. It's a different science altogether. If you do exercise, simple exercise, it's called physiotherapy. If you do add breathing exercise, with breathing if you do, it's called yoga. And yoga deals with mind and body. So that is also very good. So there is some simple variations are there, which you can do. And you asked for one more thing, what is it?
Gym.
Yoga and gym. Gym means again similar exercises only. Exercises is almost the same.
So all exercise based.
Yeah. What in physiotherapy we manage pain and we teach protocols. Like example, exercise protocols. They need to do to strengthening so that once we get strengthening, the pain will automatically come down. Once the pain comes down, then you'll be restored to normalcy. So that's what we do.
Tell me, doctor, does normalcy really happen? Because many times people say, oh, एक बार physiotherapy शुरू होने से whole life physiotherapy होगा.
नहीं, ऐसा कुछ भी नहीं है. You go to the right place, right person, right time. Definitely, it is very important. If you don't go, see, you delay the process. आप जितना भी delay करते जाओगे, then it becomes more and more. Then you go. See, ours is external based treatments. So हाथों से और external based. We don't go inside and do cut open. That's a thing of surgeons. That's not our best. So our limitation is we do it in our own things. So best of the best, ऊपर से ही करना है. So उसमें physical therapy will be the first and the best thing for anything. Instead of popping up any painkillers or any pills, this is the best thing. We can reduce the pain with exercises and other things.
And no painkillers.
Yeah. We should avoid painkillers as much as possible. Any chemical is a chemical. So you can always avoid it.
So share your experiences with us, please.
Oh, there are a lot of experiences. So